My name is Dr. Aisha Javeen, and I've been practicing dentistry from past 20 years. Thank you for giving me this opportunity to speak about how we have made changes to our dental industry since this unfortunate pandemic. I was very delighted when Henna gave me the opportunity to share some of my experiences, and I really appreciate Henna for all her efforts in keeping all our older sisters informed and educated. As the owner of Castle Oaks Dentistry in Brampton and Dentistry on 14 in Markham, like many business owners, I've had to adapt and to overcome the challenges brought to us during this pandemic. And safety and security is our top concern of every business owner, whether it is me or any other business owner regarding their staff, their employees, their customers, their patients. So let's come to the topic dentistry and COVID-19, how we have made changes in dentistry during this unfortunate pandemic. So how are we as employees or as a staff members, what we do to our staff? So every morning we come in, we disinfect all the surfaces, our reception, our operatories, the sanitizing area, the office is cleaned with the Lysol or and disinfectant solution every morning and in between the patients. All the clinical staff and the dentists, they wear personal protective equipment, which includes face shield, gown, and they are used for individual patient, and gloves and 95 masks. There's a physical distancing between the staff members. There are scheduled lunch breaks. And all the staff members are always wearing a mask in the office. And when the moment we enter the clinic, all of us, we record our temperature, and we record our temperature in the start of the day, and we record our temperature at the end of the day. And for patients, what are the safety guidelines we're following for the patients? The appointments will be spaced out. There will be physical distancing. There is disinfecting between patients. There is less flexibility when you schedule your appointment. So you will be called before your appointment. On confirmation of your appointment, we will be asking your COVID symptoms. We will screen you for your COVID symptoms before you have your appointment and upon your arrival at the dental office. You will also have a temperature check. So we will also have a touchless thermometer, which records your temperature. And we also do have pulse oximeter, which we record. And we also have a screening assessment tool in which you sign the form, which we sign for the screening form, where we have all the questions for COVID-19. You wear a mask or a facial covering in the office at all times, unless you're asked to remove it. We might ask you to come alone in only situation if you're an older adult, or you need a translator, or or if it's a small child and the parent wants to be in the room. Only one person is allowed at one time during their appointment. Questions?
Hi, my question is how seniors can take care of their oral hygiene at home?
So for seniors, they should be brushing their teeth twice daily. Since a lot of our seniors take a lot of medications for diabetes, blood pressure, cholesterol, heart disease, and other conditions. So they should regularly, after every meal, they should rinse their mouth with water, swish with water, and keep their mouth clean. If they're able to floss, floss daily. Otherwise, there are floss mates which they can use to clean in between. And here, eat a healthy, regular meals, small meals with breaks in between and after every meal. And if they eat anything sugary, to swish their mouth with water every time after every meal, and wait for half an hour to brush after they eat anything which has sugar in it, and use a fluoride toothpaste. Did that answer your question?
Yeah, thank you.
Thank you so much. Thank you so much, Aisha, Dr. Aisha,
Thank
for your session. Thank you once again.
thank you so much. Thank you for giving me this opportunity, Hannah. Thank you again. You guys have a wonderful night.
Thank you.
Thank you.
Thank you.